Okay, here we go. Let me just make sure that we're actually live. Okay, we are actually live. It's working. Okay. Dr. Davis, you are Dr. Jeffrey Davis at Scotland County Hospital. Can you just introduce yourself and tell everybody what you do there at the hospital?
Sure. Like you said, I'm Jeff Davis. I'm a family physician here at Scotland County Hospital up in Memphis, Missouri. And I serve the role of the Chief Medical Officer for the health system, our hospital, and our rural health clinics. And then I also serve the role as Medical Director of the health clinic there in Edina that Scotland County Hospital has in partnership with Blessing Hospital, and the medical director here at the Memphis Medical Services in Memphis as well.
Thank you. So we wanted to do this interview, and I know that it's been really busy there at the hospital. I really appreciate you doing this.
Welcome.
I think let's just jump right in, and can you just tell us, what has it been like at the hospital as far as patient load and staffing shortages are concerned?
Yeah, so a couple things that have been happening really in the last 2 to 3 weeks, as we have seen a surge in COVID positive patients in Northeast Missouri and Southeast Iowa. The hospital really, takes care of people that come out of Schuyler County, Scotland County, Knox County, Clark County, and then some of the southern tier counties in Iowa. But we'll occasionally, have patients that we take care of from Putnam County or Adair County and Lewis County as well. And so we have a fairly large regional service area, and that area has been particularly hard hit with an increase in COVID cases. And so there's multiple places in the health system that we're seeing stress on our ability to provide services. The emergency department, our numbers of patients presenting to the emergency department have increased, and the acuity or the severity of their illness has increased to what we are normally accustomed to. That puts a burden on the providers that are there, the physicians, nurse practitioners, and physician assistants, as well as the nurses. And with these COVID patients that are fairly sick, then our respiratory therapy staff, our laboratory technicians, our radiology technicians are also stressed and put to the strain as well. When we interact with these patients in isolated areas, we have to have a complete set of PPE on that includes, N95 masks and goggles, hair coverings, shoe coverings, gowns, and then those get changed in and out as we come in and out of that care area to evaluate them so that we reduce the risk of transmission of the disease to, the caregivers that are helping to provide for them. And because we've seen those numbers in the emergency department increase, that's led to more of those people with severe disease being admitted to the hospital or transferred to a higher level of care, tertiary care centers in the tri-state area. And that's led to a burden then on our inpatient medical wing. And all the way back in March and April, we had our, maintenance services put up isolation areas in the inpatient wing, and that limits then the non-COVID patients as well as the COVID patients to that area that we can take. And we have at times surged to the level where we didn't have enough beds in the isolation area as well as enough staffing to staff those areas. And that's primarily because whether it's in the hospital, the emergency department, the clinic, or our acute care clinic for respiratory illnesses at this time of year, they've all seen staffing shortages because of the number of our own employees who have contracted COVID illness related either to transmission from a family member or social transmission in the community, or getting exposed to it at work from either a fellow employee or a patient encounter. And so they're out for those reasons if they have COVID. Also, if their children have COVID or if their spouses have COVID, and then they become quarantined because of a close contact with a family member or something like that, even when they're not COVID positive. So that's resulted in a staffing shortage. We've been anywhere from 10 to 15% of our full-time employees have been out at any one time. Yesterday we were at 15%. Today I think we're right at 15%, if not just a little bit under that, for staff not being able to report to duty, which then puts a strain on our ability to provide for the patients, whether they're COVID patients or not, who are requiring medical care.
With those staffing shortages, and I know you guys put out an all call for, retirees or people with medical experience to please apply and kind of fill in some of that gap. Have you had a response from the communities around to help kind of fill in where it's needed?
Yes, we definitely have. Within a few hours of that information being put out there, we had some semi-retired or part-time nurses contact us. And initially, the ones that have contacted us were ones that had active licenses because they were either recently retired or part-time. And they've offered anything. But one of the first nurses that reached out to us was from Monroe County in the Monroe City area, and had reported that they had a job, but they had Saturdays free and possibly even some nights that if we could utilize them to show them what we needed and see if they could meet the need. We've had nurses retired from the state of Iowa who know someone in Scotland County or had some relationship with the hospital previously that have also reached out to us. And we've continued. That's been about a week now to 10 days ago that we put out that all call. And we've continued daily to have people either communicate with us through our Facebook page or through our hospital's website on the internet, or call directly and speak with our staff on showing interest in volunteering, assisting us in whatever way we can.
And going a little deeper into that, just to kind of throw this one in, I noticed, you guys are advertising for custodial and also daycare staff.
Yeah. For both reasons, what we have had happen is we've had COVID, either exposure or disease, be contracted or to be exposed by some of our maintenance, housekeeping, and daycare staff, as well as other staff. This has not only affected one type of staff member. We've had many nurses, but we've also had physicians, physician assistants, nurse practitioners, clinic nurses, hospital nurses, custodial staff, the housekeeping staff, business office workers that have either had to be quarantined or have had to actually be isolated because of a illness with COVID as well. And we've had other volunteers for those things as well. One thing that happened here recently, Scotland County schools went completely virtual as of last Thursday night. And so Friday, Monday, Tuesday, Wednesday, virtual going into the Thanksgiving holiday here. That meant no open school for those kiddos to go. And so many of our staff members have young children in the elementary school that did not have a daycare arrangement already made. And we've even had a daycare in our community temporarily have to close. And so that was more of a shortage in daycare. And so many of those were going to have to stay at home and help their children do their virtual classroom. And we had been discussing it for a while, and when we got that call that was going to happen, we scrambled, got some volunteers, And we actually have now a monitoring service that is offered to our employees' children to monitor them in an area where they're able to socially distance. They wear their masks. They have their tablets or their laptop computers. We get them access to our Wi-Fi. And then they have a monitor that they're not tutoring them. They're not teachers. They're, making sure that they're well, that they're safe, that they can make it to the bathroom and back, that they stay active on their assignments while their parents are working in the hospital, because we have that level of shortage that we need every worker on hand that we can have available.
That's really amazing. And this will be a good way for people, you don't need to have medical experience to be able to lend a hand.
That's right. And there have been already some people without medical experience, not nurses, just contact us when we put out that call for help saying, I'm available, I want to help you, is there anything I can do in one way or another? And we've found places for those people to, volunteer and help us out one way or the other. And you're right, it does not have to be medical personnel.
Okay. Shifting back to patients, and about 10 days ago ish, when you guys kind of sent out the alert messages about the possible filling up of the hospital, have you had to turn emergency patients away since?
Yes. So we have had situations where we are on diversion. Anytime a hospital goes on diversion that's licensed by the state, we have to notify the state that we are on diversion because we don't have capacity. At that same time that we've been on diversion, other area hospitals like Blessing Hospital in Quincy, Illinois, or Northeast Regional in Kirksville, or Boone County in Columbia, the University of Missouri, Ottumwa, Fort Madison, Burlington. There have been other hospitals at that same time also on diversion, and that's put a real pinch on our emergency department staff ability to find beds available to transfer patients. And this is primarily COVID positive patients who have severe disease and need to be, admitted, but it even has happened when we've had, someone come in with a stroke, or someone come in with a myocardial infarction or an orthopedic injury. Whenever we try to get them transferred to the hospital of their choice, oftentimes that we find out that they don't have the capability to receive them. And so then we have to go down a list of trying to identify hospitals. And shortly after that happened, we began, preemptively contacting hospitals twice daily, finding out what their bed availability was, so that if they weren't available, we didn't utilize that time, contacting them just to find out that they weren't going to be able to take our patient transfer anyway. We've, on a rolling basis, we will have patients discharged from the hospital in the morning that opens up, a bed or 2 beds or 3 beds. And then basically, within hours, and sometimes we even have patients in the emergency department being stabilized, needing admission, that wait in the emergency department until a bed is vacated by a discharged patient, and then we quickly fill those beds right back up. We have been lucky that we have maintained the staff level that we have. We also have put into place some things like canceling and postponing non-essential surgical procedures so that we could free up some of our OR nursing staff who are competent and capable to work on the floor, so that we could increase our bed numbers to be able to accommodate an increased number of these patients. But yesterday we had 7 COVID patients in the hospital, which is very near our capacity of those beds in that isolated area. Today we have 6 in the hospital. And then we have other non-COVID, beds that are already full. We have 6 or 7 non-COVID patients that are in the hospital as well. We have a full obstetric department right now 3 moms, 3 babies this morning when the day started. There are labor inductions and cesarean sections and all those things that still have to continue to happen because those babies don't stay in there and wait for the pandemic to get over. And so, it just really has put a significant strain on the system, and we're trying to do everything we can to make sure that we meet the community's needs.
So, I mean, just going back to when you were diverting, where were do you know, like, where the patients were landing?
Yeah, we had some go to Iowa City, the University of Iowa in Iowa City. We've used them before for regular transfer. There occasionally are patients who have some relationship with physician up there, already, either through the veteran system that they have in Iowa City or the University of Iowa. And so we're not, it's not foreign to us to transfer someone there. It's just outside of our normal service range. Barnes Jewish in St. Louis. And I believe we even had a patient recently end up in Kansas City for transfer as well. So we have been able to place all of those. The other thing that we're running into right now, and this COVID illness that I think the listeners or readers of information need to understand is that you might come down with COVID and not feel too bad when you first get tested positive, a scratchy throat or a slight cough, some headache or fullness in your ears. But 4 or 5 days later from then you could begin having increased cough and develop some shortness of breath with activity. And that's when people really need to be evaluated to find out if they have an oxygen requirement, because if you need oxygen and you don't have oxygen, you can't just go to the grocery store and pick a bottle up to give you oxygen. That has to be provided to you medically. And then someone like that might come into the emergency department, but after their full evaluation, they're not in the shape that they need admitted. They need oxygen. Because their symptoms are still just not, severe enough, and we're hoping that they turn the corner and they improve. So they get discharged back to home, and then a day or two later, their condition may continue to worsen because we find that the COVID patients, like on day 7, day 8, day 9, and day 10, those 4 days of the illness are probably the worst for those that are going to have severe illness. For those that have mild disease only, by day 7, day 8, they're feeling almost, back to themselves, and that's why 10-day isolation period for most people with mild illness, and they're back to work and felt to not be contagious, according to the CDC and infectious disease experts. That's what has happened some too, is people we didn't need to admit them here. They didn't necessarily need to be transferred, but were discharged, and then a day or two later are sicker and return to the hospital, again for care. With
needing oxygen and things like that, you're also the medical director here at the Edina Clinic, Edina Medical Services. Are you seeing any kind of hiccups in patients coming in the Edina Clinic and not being able to get into the hospital if that's where they need to go? Are they being shipped?
Yeah, it's been good so far. Our two busiest outpatient or remote rural health clinics, Lancaster and Edina, they both have oxygen capabilities there. We have tanks of oxygen there, and they both have tested patients for COVID. They both have identified positive tested patients that they tested came back with results positive. So they've diagnosed COVID disease. And they both have taken care of people with COVID that have presented to them because they're in some kind of trouble. Because we run walk-in clinics. We offer walk-in services at both of those places. And our staff have all of the PPE there that we have in our emergency department, from N95s to goggles and face shields and all those things. And then if their oxygen saturations are low, they can have oxygen applied, given to them. If they continue to require that oxygen and they're not able to be titrated off of it, or their condition doesn't improve just in the time that they're in the clinic, then we have to call 911. Like any other clinic or any other nursing home or setting, where someone needs to be then transferred to an emergency department. And none of the emergency departments are on diversion, so it doesn't matter whether it's Blessings or Northeast or ours. They take all comers because emergency departments have to, unless they have something has happened and they don't have any doctors available, or they've had a facility problem that they've had to shut down their emergency department. So that's gone pretty well, not many hiccups. And what we would ask anybody to do is either if they're COVID positive or they were exposed and they think they have COVID and they're in that kind of distress, they really need to call the clinic there in Edina or call our COVID hotline at Scotland County Hospital's COVID hotline, because it's manned 24 hours a day. That number is 660-956-6820. 956-6820. That's our COVID hotline. And they can get guidance on, you need to call 911. You need to go to the nearest emergency department if you're not in that much distress. Or, if you haven't been tested and the clinic is open there in Edina, why don't you get a mask on? We'll let them know you're coming so that they can be in their PPE and you can, go in and be tested there. So it's really going pretty well so far.
That's great. Yeah, I was wondering about that. Wondering if, because you would have kind of really know, like if these local smaller clinics are really kind of helping to ease the pressure on the rural hospitals. It sounds like, with the capability
they are
to
some, that the thing that they're not able to do is obviously if someone needs that emergency medical care and then to be admitted to the hospital or whatever, they're obviously not able to, provide those services, but they are able to keep that care close to home for people that are, they just need evaluated to find out do they need to go to the ER or not, or to find out do they need a test or not, and to receive a test. They're able to do all of those things. I don't know I haven't talked to Lori Moots at the administrator at your health department, but we've already began having influenza positive patients. We had a positive result on Monday in our acute care clinic for a patient that also tested positive for COVID. We also had an admitted influenza B patient last week to the hospital who had respiratory illness bad enough that they needed to be admitted to the hospital and receive care. So we are now beginning to see the dual disease of influenza and COVID beginning affecting the way that we take care of patients in the outpatient clinic, the emergency department, and the hospital.
That's concerning.
Yeah, it really is, and that's why we've advocated, and I know Lori has too. There's been a lot of information about how important it is for people to receive their influenza vaccinations, and it's not too late. There's still influenza vaccines available at pharmacies and clinics. Our Edina clinic has influenza vaccine. We're giving it here in our acute respiratory care clinic, and we're giving it in the clinic here at Memphis Medical Services. But it's very important because if your immune system is prepared to help take care of the influenza, and please no one think that if you get influenza, that's going to keep you from getting COVID either at the same time or at another time. They're two separate viruses. They both will take the opportunity to infect the human body when they get the chance.
I know you guys are busy there, and I'm going to wrap this up pretty quick. I just have a couple more.
That's okay.
Are you planning for a possible even more of an influx after the Thanksgiving weekend?
Yeah, and if you've been, I know you've been reading, and if you've been reading or other people that are listening have been reading, is everything big happens around 2 weeks, 10 days, 2 weeks to 3 weeks after a big social time. When it was the 4th of July, our summer surge hit in mid to late July. When it was Labor Day, our next surge began hitting in October. And so it won't be the weekend after Thanksgiving that we're really that concerned about the Thanksgiving gatherings causing the numbers, because people will get exposed at that time. They'll begin developing symptoms on Monday or Tuesday. They'll get tested for COVID somewhere, on Tuesday, Wednesday, or Thursday. they'll find out from a family member who was at Thanksgiving that that family member got sick that night or the next day, and then they went and got tested on Friday or Saturday, and they were positive, so then they now know they're an exposure. But it's when all of those people reach that 7th, 8th, 9th, 10th day of their COVID illness that then they'll be in the ER. They'll need to be being admitted to the hospital for this care. And so we're really looking at, early to mid-December, and it's being expected everywhere in the Midwest. I know St. Louis has been out there saying that at the current increased rates that they're seeing that have continued to stay high and increase after a Thanksgiving holiday, if those rates go up, that those hospitals, and we're no different in our area, just won't be able to sustain the increased number of, to care for the sustained increased number of patients. And so we actually, the hospital board of directors met last night. We are in a management agreement and affiliation with Blessing Hospital, and so their leadership were on the Zoom call for the hospital board meeting last night as well, and we discussed crisis standards of care. And crisis standards of care, the Health and Human Services, HHS for the federal government, and DHSS for the state of Missouri. What that means is when a mass casualty happens, some kind of explosion or plane crash or anything like that, what standard of care are you going to provide when your resources become overwhelmed, and how do you decide which patients get which care to best.
So basically triaging?
Yeah, basically triaging. That's crisis standards of care. And, people don't really realize that this pandemic is unprecedented in our time. We have not had a pandemic with this type of disease burden ever in the history of Scotland County Hospital, because we weren't here in the, influenza pandemic of 1918. And this has far surpassed MERS or, the first SARS that was around, or H1N1. This is way beyond H1N1. And we have to plan ahead of time for what will we do if we don't have physically enough beds. Then where do we begin caring for people? If we physically don't have enough oxygen equipment, where will those people get oxygen delivered to them? If we physically don't have enough ventilators or positive pressure machines to provide for them, where will people get those services? And if we've ordered more of all this stuff, we're waiting on all of it to arrive. But if it hasn't arrived yet, we have to have a plan to provide a certain level of care, standard of care, to help the largest majority of the population the best that we can. And so, you end up you have to have an ethics committee to help make decisions like that, and you have to have plans put in place so that you can be prepared so it doesn't catch you off guard. Because what we know happened in New York City, they were caught off guard, and it was chaos. And it still will be chaos when something like that happens. But if you've planned for it and you've made policies and you've trained people on how they're going to handle it and react, you're in a better situation than if it just is like a tsunami that you're not prepared for.
Just the thought of triaging or the crisis standards of care is sobering.
Yeah, and I think it should be. And we have to realize that we might think we're a very advanced country, and we are, but we are not that much more advanced than Italy, Germany, France, New York City, and there were triaging that had to occur where the minimal services that were available were given to those that were most likely to survive and had the longest survival longevity left. And those are hard things to think about. They're hard things to talk about, but they're the kinds of things that we need to think about or be aware of might happen if we continue to practice, our social lives as usual, or our economic lives as usual, because there are real things that can't happen because we were locked down in April and May, and we had an empty hospital, empty beds, people standing around. We had to furlough people because we didn't have cases. And I guarantee you can talk to any hospital employee, and they know that there is a monumental and significant difference between what we're seeing right now and what was happening in May. And that's happened for a reason. You know what I mean? It didn't just, it wasn't like it was there then and we just didn't know it. It wasn't there. It's here now, and we're dealing with it. And we're doing a great job. Our healthcare workers are resilient. They show up every day when they're capable of it, and they're providing, the highest quality of care and the best care that is available. But we want it to continue to be that way for every person, every time, and not come to a situation where we get into that triaging and crisis standards of care.
And that's a great segue into my last question, which is, what is the mood like there? Are there signs of fatigue, depression among the staff? What are you guys doing to keep morale up?
So yeah, there's definitely a lot of stress, a lot of tension. There's a lot of melancholy, seriousness, especially from those that are taking care of the COVID patients. There are many staff members who themselves had some question about whether this would ever really affect us in any way at all, and why are we locking down, and why are we closing schools, and why were we ever doing any of this? Look, we haven't even seen a single COVID positive patient. And now that they're taking care of these patients and seeing these patients, and they're their community members and neighbors, it's shocking to them. And that has a certain emotional toll, for those individuals. And there definitely is fatigue. There definitely is, we have nurses. We went actually a few weeks ago, if not several weeks ago, to mandatory overtime. All nurses that work 12-hour shifts in the hospital work 4 instead of 3, which is the standard, because we had shortages in areas, and we were trying to provide for the maximum amount of patients that we could take care of. And, at 48-hour weeks, every single week, when you're taking care of these COVID patients wearing PPE, it starts to wear thin on everyone's nerves and their stamina. And so, there's physical fatigue, there's mental fatigue. We're watching for signs of burnout. We have met with our supervisors in every department, asking them to keep a close eye on all of their employees, to speak with all of their employees about coming to them if they have any, issues or concerns. We have just last night announced to our board employee program for mental health. It's an employee assistance program, an EAP. We've had one for forever because it's a requirement, but we beefed ours up here in the last few weeks, really aiming at being there for our staff that are, put to the test by this pandemic and the care that they're, being asked to give to these patients. It's very sad to say, but we have had more fatalities that our employees have witnessed in a short period of time than many have seen in their career as a nurse. Because if they've only worked 3 or 4 years, they may have been involved in, resuscitation effort with success or without success only a few times. And this is now happening, weekly, if not daily, or we've even had days where it's happened more than once in one day. So that is something that they're not accustomed to. Even employees maybe that have worked in lab or radiology or physical therapy who maybe have worked at the hospital for 15 years or 20 years, and they haven't been on duty when one of the patients that they've been caring for crashes and requires intubation and emergency transfer and those kind of things. And those are things that they all say when you hear them talk about it. These are things that only happen in big hospitals. These are only things that we thought happened in St. Louis and Kansas City and New York City. And they're becoming more commonplace here because of the situation that we're dealing with. And that takes a mental toll on them. And Scotland County Hospital has this employee assistance program now with robust mental health. They are able to access it themselves discreetly, privately, 24/7, and they also have their supervisors they can go to. And we have a quality assurance and HR department that's led by Terry Schmidt, who's an employee that has a background in behavioral health, and she's the one that's been working the hardest on employee burnout, depression, fatigue, and this employee assistance program. And they all know that they can reach out to her and her staff in that office, and we're trying to do everything we can to make that as open and available to them as possible, and encourage them to use it, trying as hard as we can to destigmatize any emotional distress or trauma that our employees witness or have related to the care of these patients.
What can the people who hear this interview, what can the community do to help you and people, folks at the hospital?
Well, the things we've been talking about forever are still very important. Because we don't have a vaccine yet, and one is soon on the horizon, hand hygiene and mask wearing and social distancing are about the only things that we can do. But I would also recommend, and we just talked about this at a meeting earlier today, everyone thinking about educating themselves on the disease as much as they can. Anything that's reputable that they can read about the disease. WebMD has things, Mayo Clinic has things, Blessing Hospital has resources. You can get online if you can get online, because what we're seeing a lot of times is people get diagnosed with it, and they don't really still modify their behavior in their families that much. The number one way in Northeast Missouri that people are contracting the virus right now is family spread. And so people need to really take being diagnosed with it seriously, even if they have mild symptoms or no symptoms, to make sure that they don't transmit it to another. And so really following recommendations on not going to the grocery store, not going to a restaurant, not going to those locations for sure if you're positive, for sure if you've been exposed and you're asked to quarantine, and for sure if you have a respiratory illness, a cough, runny nose, headache, fever, even diarrhea, abdominal discomfort, body aches, go ahead and do the right thing. Isolate yourself from possibly spreading it to others, because I really believe that if we all practice just common sense, I'm sick, I don't feel well, I've been told I have a transmissible disease, I'm going to do what I can to make sure I don't give it to anybody else. But I really think what's happening is there's so many cases of it that are mild. It's still 90%. 85 to 90% of the cases end up being mild. They don't go to the ER. They don't get hospitalized. And that would cause a lot of people to say, oh, then what's the big deal? And the big deal is that we're having these, 45, 50, 55, 60-year-olds who aren't, octogenarians with 5 or 6 chronic medical conditions, and they're getting sick enough that their life is in danger is not severely compromised for the time period that they're, admitted to the hospital and receiving oxygen. And so everybody just, having it in the front of their mind, thinking about when they encounter someone, hey, that person might have COVID and not know it. I'm going to keep my distance. I might have COVID and not know it. I'm not going to get in somebody else's face. And if people can make those types of decisions, I think we can help flatten the curve, lower the numbers locally so that we don't outstrip our resources in the emergency department and in the hospital here or in the region.
Okay, and on that note, I am going to say thank you so much for doing this interview. It was a long one.
Yeah, well, thanks for reaching out to us, and I hope I provided some information that can help our situation here because we need help.
Thank you so much.
Yeah.
Happy Thanksgiving.
Yeah, thank you, Echo.
Okay, I will talk to you later.
Okay, bye-bye.
Okay, bye. Okay, that was a very sobering interview with Dr. Jeff Davis at Scotland County Hospital. I'm going to go ahead and shut it down for now. Thank you so much for watching this very long interview, and if I could find a way to get audio up somewhere, I will do that. And I hope everyone has a very safe holiday, and so I'm going to go ahead and sign off for now. I'm Echo Menges for the Edina Sentinel and the Nemo News Media Group. There's a number of our newspapers live streaming this simultaneously, and so if you like, you can go ahead and share it to people in the region, people in the area, people in counties that are served by Scotland County Hospital. Knowledge is power, and so on that note, I'm going to say Happy Thanksgiving again, and we'll be seeing you in the future. Sign off for now.